Hi everyone! So today marks 1 year since I had my spine surgery, so I thought I would jump on here and share my experience with you all. Okay, so before I jump into the surgery, I thought I would just take a couple of steps back and explain how this all kind of came about. So I've always had some dull back pain for, many years. I just always assumed it was due to having like an office job, like a desk job, bad posture, something like that. But one morning I woke up and it was so bad. It was like no other back pain I had ever had. And again, I kind of just thought it was due to traveling. I had just flown from LA to Brisbane in Australia, and I'd just woken up in an Airbnb, so it was a different bed I wasn't used to or anything. So again, I just sort of didn't think anything really much of it. I just thought as the day goes on, like the muscles will sort of relax and it'll sort of shake itself out, But no, that did not happen. The opposite happened. Things just got more and more and more painful as the day went on. So I ended up going to the doctor while I was there in Australia and just sort of explained what had happened. They did like a few in-clinic tests just to check for any broken bones or something along those lines. And I was in Australia for maybe 1 more week. So they just gave me some pain medication and things, and also some nerve medications, and just said, when you get back to the US, obviously see your primary doctor. So I'm back home in the US. I live in San Diego, and I went to my primary doctor and I explained everything that happened while I was back in Australia. And she's like, okay, let's get some x-rays done. So I got the x-rays done. The x-rays didn't show anything. So she's like, okay, I was still in a lot of pain. And she's like, all right, let's get an MRI. And I'm going to have to refer you over to orthopedics. So I got the MRI done. This is what it looks like. As you can see the herniated disc there at L4, L5, and L1 through to S1, maybe S2, has a lot of degeneration, and I have some spinal stenosis there as well. So there was like a ticking time bomb there that I had no idea about. I honestly just thought I had some dull back pain and didn't understand what really was happening back there. So my surgeon went through and explained everything to me that was on the MRI. We also talked a lot about my right leg, which has a lot of numbness and tingling and a weakness in the ankle, and my right foot actually has some foot drop. So what we ended up talking about was that if I had the herniated disc but no foot drop, he said we could have looked at just doing some PT first and seeing if that would have helped my situation. But unfortunately, the foot drop was of really big concern to him and was something that he felt wouldn't get better with physical therapy. And as you can see, my spinal cord is completely depressed. So my surgeon was really, really concerned about that. He was just, he was not sure how that's going to be repaired with physical therapy. So he was really felt very confident that surgery would be necessary and helpful for me. So the surgery that was recommended for me was a lumbar decompression, specifically a microdiscectomy. So that was a really, really intense couple of weeks. I was just in Australia visiting my family, and then a few weeks later, I was getting rolled in for spinal surgery. So my insurance approved my surgery and we were set to go. So for that 2 weeks I had to wait for my surgery date, I just basically rested, but I also spent a lot of time getting my house ready for my recovery. So I did a lot of research online, watching these types of videos, just to see other people's experiences and what they struggled with and what things helped, that sort of thing. So what I found is that a lot of people had difficulty getting in and out of bed, getting on and off the toilet, picking things up off the ground, and obviously pain, that type of thing. So what I found online was this toilet seat riser. So I ended up getting this and it was fantastic. It was super duper useful because getting on and off the toilet is really difficult. Like, you wouldn't really believe that much is difficult, but once you've had a spine surgery, it's really, really difficult. So highly, highly recommend a toilet seat riser. So I have a counter to the left of my toilet. So I would use that to sort of balance and pull myself up. But if you don't have a counter, I'd highly recommend getting a toilet seat riser that has the handles or a frame that can go around. Highly recommend it. The other thing I really liked was this grabber. So I used that to pick things up off the ground. Like, I never realized how much I drop stuff, but even it was useful just to pick up a soft toy that I would throw to my dog instead of having to bend over all the time. It was really, really helpful. The other thing I got was one of these ice packs. So this is one that wraps around your lower back and it's Velcro there, and it's got 2 gel inserts, so you can always have one in the freezer. So this was really, really useful and amazing as well. The other thing I got was a water bottle with a straw. So that meant I could lay in bed, drink water, but I wouldn't have to like move my body too much because it was painful. And also I wouldn't have to be concerned about water going everywhere. So in this 2-week period, I also stopped taking all my supplements, specifically the omega-3s. I went to the pharmacy and picked up all my post-op medication, such as all the pain meds and the stool softener. And I went to get all my blood work done, all of that stuff. And also arrange like dog walking and all those bits and pieces. So when I got home, as much as possible was as organized as possible to just make that transition from surgery and recovery as smooth as possible. All right, so it's surgery day. I woke up at 4 a.m., extremely early. I jumped into the shower and I had to wash myself with the Heavy Clean. I had been using that for a few days prior as well. And then after washing myself with that, I then put on some fresh, clean clothes. And then we dropped our dog off at our neighbor's. And then my husband took me to the hospital. So my pre-op appointment was at 5:30 a.m. So I showed up at the hospital with my husband. We did the check-in, but I pretty much had to say goodbye to him straight away. And the nurse, took me into the pre-op area. I laid down on the bed and they gave me a gown, some socks, and a bunch of like wipes, again, to wipe my body down. I think they were like Heavy Clean type of wipes. So I had to wipe my whole body down, not just the surgical area, but I had to wipe my whole body down, even though I had just had a shower like an hour and a half or so earlier. So it seemed like a lot of cleaning, but I'm thankful, I guess, of how careful they are with getting, preventing infection as much as possible. Then the nurse came back and gave me a little cup and got me to go to the bathroom because I had to do a pregnancy test, because if I was pregnant, they wouldn't do the surgery. And then came in with a little Q-tip with some betadine on it and put that around my nose, up my nose. And that's just for helping with MRSA prevention. What else? I've got some notes here. They also went through allergies, medications, all of those things. They went through and asked me if I had any cuts, any bruises, anything like that that had to be recorded. Anything tiny wasn't a problem, but obviously if there was anything large, that had to be recorded. Yeah, so that was kind of like a lot of the pre-op stuff. Then the anesthesiologist came in and he spoke to me about the process and asked me, how I was feeling, but also asked me my experience with anesthesia and what it had been in the past, if any of my family members had woken up during surgery, that type of thing. I thankfully have not ever experienced that. That sounds absolutely terrifying. And then my surgeon came in and just sort of asked me some simple questions like, what are we here to do today? What's the surgery? What side are we operating on? Those sort of questions. And then I think I just turned like this, and he put a mark on my back, and it was all agreed. That was where we were doing the surgery, all that. So some of these steps you sort of think, oh, we've already discussed a lot of this, but honestly, it's just so good to just be prepared and know that everything is being done at the highest standard possible. So I had my phone on me the whole time, so I was able to text my husband, and I was texting my parents back in Australia. And I think I was in pre-op for maybe 2 hours, just sort of doing all those things and kind of waiting. So I think at around 7:30, they took my phone off me and my bag with my clothes and things. And then the surgical nurse rolled me into the operating room, and yeah, that moment got really, really real. I remember them rolling me in there, and I could see all the doctors and nurses in their blue gowns, the goggles, the masks, everything. I could see all the instruments everywhere. I could see the really bright surgical lights, and I could see the bed. So when they rolled me in, but that wasn't the surgical bed, so then they had to a group of people got me off that bed and onto the surgical bed, and then the anesthesiologist came up to me, put something over my face, and then I woke up in recovery. So surreal to just think that, I just find it really amazing. Surgery is just amazing to me. Anyway, so I think that was 2 hours. My surgery, 11:30, I was in recovery. The nurse called my husband, said, hey, she's waking up. Bring the car around the back of the hospital and I'll meet you there. The discharging nurse wheeled me out and then went through all the post-op sort of stuff, especially the first 24 hours. So just went through all the medications with him and that sort of thing, and just, the contact numbers if there was a problem, all of that. So then getting from the wheelchair into the car was okay. I mean, I remember it being a little painful and just awkward because I guess I was still anesthesia and pain meds and things, and just literally just had surgery. It is so surreal to me that you can have surgery and just a few hours later they're time to go home. It's honestly, I just find it mind-blowing. So once I was in the car, I just reclined the seat, and then my husband just drove home really carefully, really, nice and smoothly. So that was really great. So we were home by noon, and when I got here, I just put my some clean sweats on, and we put this ice pack around me, around the lower back, and I took my first lot of at-home pain meds. And then I just went to bed and I slept for a couple of hours. So my husband was super, super amazing. Shout out to him. What he did was he set a bunch of alarms on his phone. So one of them was for the ice pack, where he would set it for, I think, 20 minutes on, and then we'd take it off, and then 30 minutes or an hour later, we would start icing for 20 minutes again. Whether I was asleep or not, we were waking up doing this. And then every 4 or 6 hours, the alarm would go off again for the pain meds. Because all the different pain meds have different timings. So the alarm was going off all the time, 24/7 for the first few days. So that was super, super helpful because, the first few days are really hard. You've still got anesthesia and things in your body, and just to have someone there who's sort of monitoring those things and making sure that you're taking your pain meds and your icing, because those first few days are the hardest. So if you don't have someone that's home and can help you for that time, highly recommend getting a family member or best friend or someone who can come and stay with you for those few days and just really help you, because I found that I really needed someone. So he also looked after our dog and those sort of things. If you have children, of course, you would definitely need help. Couldn't imagine doing all this surgery and having to look after a child as well. So yeah, having someone to help, super essential. So that evening, I remember I had a small meal. I wasn't super hungry because I guess the anesthesia or the pain or whatever, I just didn't have much appetite. But I did eat, and I also went for a walk around the house and just sort of stretched my legs, get the blood flowing, that type of thing. And then just went back to bed, and it wasn't like the best sleep. Again, you're sleeping on your back, like on your incision, but also the alarm's going off all the time for the icing and the pain meds. But yeah, it was fine. And my little dog, little Chihuahua, wanted to be on top of me, which wasn't the best, but I feel like he had some healing medicine of his own that he could give me. So the first week was kind of rough. I'm not gonna lie to you. I found it really hard. I just was so tired, and the pain really started to kick in. I was still taking my pain medication and icing and all of that stuff, but I guess the anesthesia had worn off, and just sort of the reality of what had happened was sort of setting in. So my husband ended up working from home for, I think it was 10 days. So he was working from home, which was amazing because it meant he was here to help me with icing, with staying on top of medications, helping me with like drinks. And I feel bad because I was like, can you get me a drink of water? Can you get me like this? Can you help me go to the restroom? So the best thing that happened that week is that I got to have a shower, and it was, I guess I've been taking showers for granted my whole life, but that was like the nicest shower. I got to just wash off the surgery, if you know what I mean. On my back, I still had all this orange stuff all over my back. I guess some sort of like anti-infection stuff, cleaning product. I still had like surgical markings on me, all of that. So just got to wash my body. I washed my hair, which felt amazing. I was able to do it all by myself. But my husband just sort of waited in the bathroom. He was there in case I needed to, in case I felt unstable or I needed him. But honestly, I probably should have got one of those shower chairs, because I think that first week it would have been helpful for like balance, or just to sort of sit there and have the water pour over you and just kind of sit there and wash yourself. Because I definitely felt like a little unstable just because of the pain, I guess. So yeah, if you're on the fence about getting one of those shower chairs, I mean, why not get one? Because I think that it would have been really helpful. And if I have to have a surgery in the future, I'm definitely going to get one. Okay, so we're like 10 days post-surgery now, and I hadn't left the house, and I was like, okay, I got to get out of here. So I said, let's go like to a local cafe and get some lunch, get some fresh air, and we'll just come back. We don't have to be out for ages, but just a little outing. So that was so nice. I like kind of did a little bit of makeup and, put some like non-sweats on, so outside clothes. And we just drove downtown. It was about 15 minutes. So in the car, I reclined the chair as far back as it would go, put my seatbelt on, of course, and just laid while we drove, because I just, at this point, still was preferring to lay versus sit. It just felt so much more comfortable. So we're sitting at the cafe having like a nice lunch, and I can just feel this like dripping in my back, and I'm like, okay. So I go to the restroom, I have a little look, and I'm like, yeah, there's some discharge coming out of my incision. So I had been having that a little bit the first week or two, And I sent some photos to my doctor, lucky them. And they said everything was fine, the color was good, there was no infections. So, but I just felt weird. I was at the cafe and I then had all this this yucky discharge. So we ended up just finishing our lunch and just head home. When we got home, we just cleaned everything, put a fresh bandage on there, and I got back into my sweats and I had another nap because I was still really, really tired. And even that short outing out to, get some lunch was plenty for me at that stage. So I continued to take my pain meds and all of that sort of thing, but I kind of felt like they weren't working very well because I was experiencing quite a lot of pain. And it just didn't feel right given the amount of pain meds they were giving me, because they were giving me opioids, right? So I talked to my doctor about it and they switched the medications up. I tried some new things. The pain wasn't reducing. So we kind of just kept on changing the meds until something worked. I also wasn't able to take NSAIDs due to a stomach surgery I had a few years earlier. So I kind of was running on, not a lot of options. So yeah, anyway, we kept on trying different pain meds until something eventually worked. But I was still really, really concerned about the numbness specifically in my leg and the foot drop. So my back, I felt was fairly normal surgical pain, and that felt a lot better in a way, but my leg and my foot, I felt hadn't improved at all. I know it's only a couple of weeks later now, but you know your body and how your body feels. So I ended up contacting my doctor again, and he's like, okay, let's get an MRI. We'll see what's going on, make sure there's no issues. So get the MRI. This is what it looks like. As you can see here, you can see where the disc herniation has been repaired and looks amazing. And you can see the little surgical entry point and all that there. The surgeon goes through and explains the MRI to me, says, everything's looking good. We just have to give your body more time to heal and repair. And, apparently nerves take a really, really long time to regenerate. So I'm like, okay, thank you. I'm glad we've checked this and you've just said, look, we just have to give it more time. I left that appointment feeling happy because I was starting to get concerned about the numbness and the pain that I was still experiencing at such a high level. Oh, and I should say, I don't think I've mentioned this yet, but during this whole time, I have been working just a few hours or less per day, or even just a couple of hours per week, because I'm self-employed as a content creator, and I kind of tried to get some work done ahead of time before the surgery, and I was able to just keep some things, ticking over by just doing some messages and, doing emails and just a few very small things to keep business going. But at this stage, there was absolutely zero new content coming out. I was just really had taken a pause on everything that I was doing. So I think if I had to return to an office after a couple of weeks, I really would have needed a stand-up desk because I was still having so much trouble sitting. And also a flexible work environment, a very understanding manager, because some hours, some days are better than others. So yeah, if you're in this situation, I really hope that you have an accommodating boss, manager, company that you work for, because there's going to be some days that are not as smooth as others. And also by the 4-week period, I stopped using the toilet seat riser and the grabber, and I started to drive a little bit because I had stopped on my pain medication by now. So because of the numbness and the foot drop that I was experiencing, I didn't feel super confident driving, so I would just drive like small distances, and if needed, my husband would drive or just jump in an Uber, because I just felt really anxious about driving, because it's like my right leg, which is like my driving leg, if you know what I mean, like my brake and accelerator. So I just would drive a short distance, like to the doctor, 5 minutes or whatever. But yeah, at this stage I was still very concerned about driving due to the nerve issues I was experiencing with my right leg. So now we're 3 months post-surgery and life has pretty much got back to normal. We went on a little vacation to Las Vegas. We had like 4 really awesome days in Las Vegas. We went to see some shows. We went to do all sorts of things. We did take like some Ubers and things around, because if you're familiar with Las Vegas, there can be a lot of walking up and down the strip. So we did take some Ubers and things, or we just stayed in like one hotel. We didn't walk around too much. But that was so good. I get to spend a couple of really nice days with my husband and just have some fun, because the previous couple of months hadn't been that fun. So that was super awesome. I was back to pretty much full-time work with lots of breaks and that sort of thing. I found that I needed a solid 2 to 3 months to feel more back to my usual self. But I won't lie, I was still experiencing quite a bit of pain. I felt like I had recovered from the surgical pain, but I still had this dull pain in my lower back, my hip, my leg, my right leg still had a lot of numbness, and just my ankle, my foot, it just didn't feel right. So I continued going to the doctor and asking questions about what's happening, is this normal, what can be done, that sort of thing. And at this point, we had also given up on trying all different pain medications, because honestly, nothing was helping. I ended up trying all sorts of things, and like I said, I can't use NSAIDs. So I ended up using THC, which works perfectly for me, really amazing. And also the surgeon recommended doing steroid shots, so to help reduce inflammation in my lower back there. So I tried a couple of different steroid shots and different locations. So we did that, I think 3 times, different locations, different drugs, but unfortunately the steroid shots didn't help either. So I guess like it just was time. I needed to give it time to really heal. And when I needed a bit of pain relief, I would have some THC gummy, and that would really help me. I also started physical therapy. I was going 2 times a week, and I did that for 3 months, and it really helped. I was also doing all the like physical therapy exercises at home. I think at first they had me doing them like 4 times a day, and it would take me like 30 minutes to do each set. So felt like all I was doing was physical therapy for a few months there, but it was really helpful. But unfortunately, it didn't resolve the pain and the numbness that I'm having still in my right leg. So I go to my surgeon and I tell him everything that's going on still. And he's like, you know, like continue with your PT, doing your exercises at home, take some of your pain medication when needed. I told him about the THC, totally fine with it. And, you know, if you're still experiencing problems, let him know, and he would be happy to redo the surgery. And I thought, you know, what? Because he's like, oh, I could go back in there and see if there's any more tissue I can remove to help the decompression. And I just thought, oh, don't tell me I have to do all of this again. But he's like, you know, it's totally up to you. I'm not pushing you to do this at all. But that's sort of all that he thought, you know, could be done. So I end up saying, look, I really want to give this like a solid 12 months and just see how my body feels after 12 months, all the healing and all the exercises and all that, and just see how we go, and I'll check in with you again. So that's kind of where we're at this point. But I also continue to have a lot of hip pain. And whenever I would raise the hip pain, they would sort of just say, well, it must be just referred pain from your lower back. They also did a bunch of different tests, and it wasn't bursitis, it wasn't this, it wasn't that. And I just continued to feel like the hip pain I was experiencing was different to the back, because the back pain started to reduce, but the hip pain stayed at this heightened level, you know? So I just started to feel like this just wasn't quite right. So I said, you know, before we jump into doing a surgery, I'd like to give it the year, but I also want to really investigate what this hip pain is all about. So then I started on that sort of journey down that route of what was happening with my hip. Okay, so at this point, we're like 6 to 9 months post-surgery, and I'm back to everything's totally normal in terms of my life. I'm back to life stuff, full-time work, socializing, traveling around, you know, weekend trip here or there. But I just continue to have the pain in my lower back and the pain in the hip and the numbness in the right leg. So I just never quite felt right by this stage. Still, we're not at the 12-month mark, so I wasn't rushing back to surgery or anything, but I just felt like things just weren't quite right. So I continue investigating what's happening with the hip, because I really felt strongly that it was separate. So again, I get MRIs, I get all these things. I go to like 3 different hip doctors just to continue figuring out what's happening. I even got a steroid shot in my hip, and we found out that I have an impingement on the ball of my hip and torn labrum and a full thickness cracked cartilage. So as much as that sucks, I at least felt like, oh, I knew there was something like really not good happening with my hip. Like I knew there was something really bad happening there with my hip, because the pain was different to the pain I was experiencing from my back. So this hip thing had been happening for years, like 20 years, and it just slowly got worse. But like in the early years, you wouldn't notice anything. And then I guess just in the last few months, it just got worse. No one can like explain to me why it got worse. Maybe I was doing things differently because of my back. Maybe I was putting more pressure on this hip, or I was doing something different. So the symptoms around my hip issues really got exacerbated during that period. And yeah, so that's where I'm at with the hip situation. Okay, so now I'm 12 months post lumbar decompression, and I feel pretty good. To be honest, I feel pretty good in terms of the back pain and all that. The back pain is still there. When necessary, I will have some of my THC gummy. I'll put a hot pack on my back and just rest. My body still prefers to lay versus sit. So as soon as I finish this video, I'll go and lay down for a little bit. And the numbness in the leg is significantly improved from the first few months. I am driving a lot more now, all of that sort of thing. But to be honest, the back pain and the leg numbness and all of that is still there, but significantly reduced from the early days, especially the first 6 months, 3 to 6 months. So yeah, but in terms of the hip, totally separate issue, of course, to my back, but an issue I'm dealing with at the same time. I've now found out that within the next 5 years, pain dependent, I'm going to need to do a hip replacement. So yeah, so this is nuts. Never thought I'd be getting a hip replacement at 45 or, before the age of 50. So here we are. So we're just going to monitor that situation. see how things go depending on pain. She said maximum 5 years for surgery. If I experience a lot of pain in the next year, we'll do it then. In 3 years, we can do it then. So sort of that's the 5-year plan there with the hip. So yeah, I'm sort of back to normal in a way. At this stage, I have no plans to go back and redo the surgery. I feel pretty good. I definitely don't feel the same as before my surgery. I mean, like before the incident of where this all popped off. I don't feel the same, I'll be honest with you. At this point, I feel like I can live my life and I can do everything like fairly like normal, and I'm going to put off having any extra surgery for the back to redo this situation for as long as possible, because right now I feel like it's not bad enough to have to redo that. But I'm continuing to keep in contact with my surgeon and my doctors, continuing my PT exercises at home, resting my body when I need to, just really listening to my body and focusing on wellness. I'm also started mindfulness classes. I just do them online. I'm speaking to a therapist specifically about chronic pain. So just different ways to think about my body and what I'm experiencing, and to not get too like negative about it and just focus on the positives and, you know, that sort of thing. So that's pretty much where I'm up to. 12 months post lumbar decompression microdiscectomy. So let me know if you've had this surgery, if you have it coming up. Really be interested to hear how you felt after having the surgery. Has your recovery like got you back 100% to where you were before? Or do you still feel a little bit like me where you're not quite back to your usual, but you're almost there? If you're further along than me, did it take just more than a year to get back to yourself? Just let me know. Be really interested to hear. And those couple of things I mentioned in the video, the ice pack and the toilet seat riser and all that, I've got those linked down in the description box below. If you're heading into surgery and you're looking for some recommendations, those are the ones that I really used every single day, especially for the first month or so of my spine surgery recovery. So yeah, thank you so much for watching, and I'll see you in the next video.